Right now, we're going to be talking with Christine VandenDries. I'm sorry.
It's okay.
And we're going to be talking about home health. And what does home health comprise?
Home health is a certified organization that is is in-home services paid for by Medicare and private insurance. And we have nursing, physical therapy, occupational therapy, speech therapy, and home health aides to assist for short-term illnesses and recovery periods in your home.
And we're able to get into that through a doctor's prescription, or can we get into it otherwise?
Through a physician's order, yes.
We have to have a physician.
Yes.
Okay.
Yeah, it's overseen by a physician. Everything that the staff does is directed by an order from the physician.
Yeah. And where is your office?
We're located on the terrace level of Forest View.
Okay. And you have different areas around the campus that work for you, or?
Our staff goes everywhere on campus. They will come to your home wherever your home may be. The only exception is the actual skilled nursing portion of Garden Ridge.
Okay.
When your Garden Ridge skilled nursing unit is considered, as Medicare calls it, a skilled service, and so is home health. You can't have two skilled services existing at the same time. However, home health can go to long-term care, we can go to memory care, and we can go to AL.
Oh, okay. So you support those? Is that,
yes.
Yeah.
Yes.
Right.
So I know, for example, the AL units in memory care have a wellness manager, and usually that person is a clinician of some sort. So, for example, if they have a nurse on the floor, sometimes residents in AL might have a need that is a higher skill level than they are able to provide on AL due to restrictions and things that AL is allowed to do. So our skilled nurses can come into AL, even though there's a nurse working there, and provide like complex wound care, things like wound vacs, and things that like a certified wound care nurse would need to be able to do.
AL, that's assisted
living.
Okay, okay.
Yes.
So home health actually works with assisted living in addition to the nurses and aides that they have there.
Yes, we can. We can provide, just like outpatient, assisted living patients could go to outpatient rehab for their physical therapy if they're able to get there and ambulatory, able to move around. If they're not, just like in independent living, if they are not able to get out of their AL apartment, home health physical therapy can go to them instead of them having to go to outpatient rehab.
Okay. Now, the home health physical therapy, that includes both the physical therapy at Garden Ridge and our outpatient physical therapy.
So we actually have a different set of staff. So home health PT has one full-time physical therapist and several part-time therapists that work for us. They do occasionally work in other units on campus.
Now, when you say they work for, is this the outpatient?
No, for home health specifically. We are our own little entity.
Okay, so that's separate from the outpatient in Hunter's Crossing.
It is. It is.
And you have then people who go to the apartments and provide physical therapy.
They are able to, if the resident is considered homebound, just like if they were in IL. Yeah, we do, of course, practice the one team philosophy here. So we have definitely we've loaned our staff over to outpatient. They've loaned us staff. So we do tend to have some staff that cross over. And our physical therapist right now, RJ, is a former Garden Ridge physical therapist that came to us. So I think as the community grows and changes, we will see a little more of you get a physical therapist in Garden Ridge, maybe they start seeing you at home as well, and then even into outpatients so that they have some more continuity. Because I would imagine as a resident going from one type of physical therapy to another, as you progress in your disease and get better, you've got to introduce and get to know 3 separate therapists. So I think one of the goals over time is to kind of streamline some of that, and just be that one big team.
Do you have many residents who undergo in apartment physical therapy?
We do. Actually, right now, that is our biggest discipline, was mostly physical therapy. I have a lot of therapy visits that are being done on a consistent basis.
So these are residents who come from the hospital and perhaps do not go into Garden Ridge, but come directly back to their apartment, but they still need help. They still need physical therapy, and they can't go to you.
Exactly. So they come to us from a lot of different places. From medical centers, sometimes someone will have just their yearly follow-up, and the doctor will have noticed a change in their condition and recommend it. So we get them from the medical center. We get them straight out of Garden Ridge after an extended illness where they recover there and they still are not quite ready for outpatient. They come to us. Sometimes they come from external physicians, cardiologists especially. And then, of course, from the hospital. We get a lot of referrals straight from the hospital. You know, with all of the regulations with insurance and healthcare now, people are leaving the hospital so much sooner than they ever did before, and they're leaving sicker. And, you know, if they don't have the appropriate length of stay in a hospital, most insurance companies require you to have a 3-night inpatient stay. And to be inpatient, you have to meet certain criteria, and not all diseases and patients meet that criteria. So often people are not eligible to necessarily go into a skilled nursing rehab situation, and they have to come home. And that's when home health is really important to be able to come in. So
now I started out asking you questions rather than asking you what is it you want to tell us. So
that's okay.
Maybe I'd better switch and ask you what is it you'd like to tell us.
I just came on to plug the Ancillary Services Forum, also known as the Home Care Forum. We have been called Ancillary Health Services for a long time, and over the next year or so our name is going to change to Home Care, and that will be considered home health and home support. We have an annual forum. We actually just did one in the end of October, and we're doing another one April 25th in the Hunters Crossing Conference Center. There's going to be 2 sessions. So the first one is from 1:30 to 3:30, and the second one is from 7 p.m. to 9 p.m. So I encourage everybody, especially our new residents, to come out and see what's available, because it's not just home health and home support. We're going to have representatives from our medical center there. They're going to be able to talk about the services offered in the medical center as well as CarePath. Our social workers are going to be there to talk about the benefits and you know, where they're located, who they serve, so that, you know, people can put a name to a face. We're also going to have Intermissions is going to come and speak about their program as well. And although someone may feel they may not need those services today, it's always good to have that knowledge and resources. And we're going to be having packets of information for everybody with contact info. It's one of those things you stick in your drawer and hope you won't need, but someday you might, you can pull out. So we're going to do the 2 sessions, and we're asking everybody to RSVP. There was a save the date that went out several weeks ago to kind of let everybody know. And then a formal flyer with invitation should have gone in mailboxes early this week. I believe it was Monday, and it has some information on the bottom as to how to RSVP to one of the sessions. We encourage people to bring their loved ones, their family, their friends, whoever's involved in their decision making and their financials. Personally, for our department, home health and home support, I've asked some of my clinicians to come. We're going to have a 2-part session. The first portion is going to be a presentation from each department, and then we're going to kind of break, and we're all going to go back to tables, and people can come directly to the tables that they want to talk to and get more information, ask questions. My clinicians are going to come because those are the people that, you know, our residents are going to see. They're only really going to see me on TV for the most part, but those clinicians are the people that you know, are in their homes every day. So I wanted them to be able to see who it is that provides care. And then for home support, in addition to some of the nurses, Gary Lebecki, our billing specialist, is going to be at our 1:30 to 3:30 session to answer questions about home support and how it's paid for, and long-term care insurance. So he'll be available at the table for questions, and I suspect he'll be the one everyone lines up to talk to.
Well, that's going to be a lot of information, and I would say it's very important that, especially the new residents, but even us old residents, it wouldn't hurt to go and find out a little bit more about home health.
Absolutely, and it's a great way just to get to know other people you haven't seen before. Everyone's going to be seated at tables and can mingle and talk. There'll be light refreshments served at the 1:30 session and heavy hors d'oeuvres served at the evening session, because we anticipate a lot of family members will come straight from work to be here.
Probably.
To RSVP, it's on the invitation, but also you can call Beth Allman in Resident Life, and her number is 604, oh gosh, 604, I'm drawing a blank.
Where do they find it? In the directory, right?
It's in their directory. It's Beth Allman. Everybody knows Beth. She's amazing. But she's the one taking all the RSVPs for the event.
And that's ALEMAN.
ALEMAN. And now don't worry if you don't RSVP. By the time stated on the flyer, we're going to have extra seats. So if somebody decides they want to show up, or if you RSVP for yourself and your children want to come, just come on in. We'll make it work.
All right. Well, Christine, thank you very much.
My pleasure.
You've given us a lot of information.